Hi, it's Adrian Cat from Advanced Dental Artistry. Replacing a single back teeth. Well, often it's the molar teeth that we actually have to replace because molar teeth come out through the ages of 6, and they are teeth that we use a lot for chewing and biting, so it's very common to see these teeth actually end up with large restorations, sometimes root canals or crowns, and we do see a lot of loss and fracture of these teeth. And when they're removed, the problem is because there's such an important biting tooth and they're kind of in the middle of the arch, we do see the teeth shift and drop around this gap. So replacing a tooth is actually very important. In this case that I'm going to talk you through, it's actually Lance. He's come to see us because he's missing a premolar teeth. We're actually going to talk you through the case and I'll show you how we replace a missing single back tooth.
One of the best things about being a dentist for over 20 years is you get to see patients over a very long period of time. This case actually goes for around 11 years. It really shows you why sometimes people actually just lose teeth even though they're really trying to take care of their teeth for the long term. This is Lance. We're looking at his upper left first premolar. You can see this photo actually from May 2006 that he has a silver filling inside his tooth, and this silver filling actually looks quite small, but it's very, very deep. One of the issues with silver fillings is because they are metal, they do expand and contract with temperature, and being a back tooth, we always chew in our back teeth, of course, and this can lead to cracks or fractures actually inside the tooth. So now we're fast forwarding here to January 2010 now, and you can see in this photo that the entire crown has actually fractured and the nerve is actually exposed. And when we look at a side view, you can actually see that most of the side of the tooth is actually missing. Although it's considered a back tooth, actually, when we actually look at the front view, you can see that tooth number 4 on the patient's upper left hand side here, you can't see the tooth anymore because the tooth has actually fractured right off, and of course this does affect the smile. When we look at the options that we actually gave Lance back at this time, it was either one, to extract the tooth and possibly look at replacement at that stage, or we could refer him to an endodontist. An endodontist is someone that only does root canal treatment, and to really assess the tooth and see whether it's worthwhile actually root canaling the tooth. He actually went along to the endodontist, and the endodontist said that the prognosis was actually pretty good, so he decided that he did want to try and save the tooth, so he had the root canal treatment done. The endodontist also suggested a porcelain crown on the tooth because these teeth are actually brittle, they're dead, and there's no nerve in the tooth, so that there's no sensation from the tooth, and a porcelain crown was actually recommended. So between March and April 2010, he actually had root canal treatment done. This is now May 2011. You can see root canal treatment has been completed, but Lance, due to time and cost, did not get the porcelain crown completed. And as we mentioned, because the tooth is brittle and without any nerve sensation, he bit on something very hard and the tooth actually fractured. Again, the two options were given to him: do we remove the tooth or do we try and save the tooth with what we call a post-core and crown? And that means that we're building up this tooth and then we're placing a crown over the top of that. You can see in this photo now, July 2011, that's the porcelain crown on the tooth, and you can see it just looks like a normal tooth now. A full porcelain crown is placed. He did his normal biting and chewing on the tooth, and unfortunately in July 2016 he had a root fracture. So this is not the porcelain crown that's fractured, this is actually the roots of the tooth have actually fractured. And when this happens, this is of course the foundations of the tooth, and we can't save the tooth must be removed. So in July 2016 he opted to have the tooth removed, but to be replaced with a single implant. You can see we've removed the tooth here. Sorry about the gory photos. You can see the implant's actually been placed right in the middle, but you can see there's a gap on either side where the bone is because the tooth is wider than the implant that goes in. We're then going to fill this with artificial bone or bios, and then over the top of this we place a collagen membrane, basically to stop the gum growing into the graft. We then close it all over with resorbable sutures, and those sutures will actually come away in around about 2 weeks by themselves. Then we let everything heal. So we normally let everything heal for around about 3 to 6 months, and you can see here in November 2016 we're taking the shade, or we're matching, the ceramics is matching the color of the new porcelain crown, which is an implant porcelain crown. In the mouth, what we actually have is we have a healing abutment, and you can see that in the mouth, and of course this is actually tooth number 4, so when Lance smiles you can see the healing abutment there. This is actually the implant crown, so you can see this is a screw retained implant crown, which is actually probably the best one to actually use. It goes straight to the actual implant itself, and this is a close-up view of the implant crown. When we undo the healing abutments, this is what it actually looks like. You can actually see the implant there, and it's ready to actually receive the implant crown, and that's the porcelain implant crown actually screwed into place. From a side view, you can actually see there the side profile. And here's a final portrait of Lance. This is 10 years after that original portrait you saw right at the start of the video.
Well, thanks for watching Lance's case, and it's very important when we are doing a single teeth replacements, even on a back tooth, that cosmetically the result must be excellent. In this case, because it's a premolar, it is closer to the front of the mouth, so we really want to make sure that the cosmetics is actually perfect. And if you have any questions, please give us a ring at 1-800-SMILING. I look forward to one day seeing you in the practice.